So hello students, and let us now discuss the interior of cranium. Interior of cranium, plenty of MCQs on this topic. They ask in the exams, the interior of the skull. We have to know the various foramens and the structures passing through the various foramen of the skull. Right, students? So I'll draw a very easy slide for you. Here we begin with interior of the cranium. Have a look at this. Now, students, I'd drawn the slide in the previous lectures also. If you can tell me what is this known as? Something like this. This is known as the lesser wing of sphenoid bone. Lesser wing of sphenoid. What is this? This is a hard part, very hard like a rock. It's very hard like a rock. This part of the bone, very hard like a rock. What do you call this as? The petrous part of the temporal bone. Petrous part. Here. So what is here? What is lying here? That's a pituitary fossa. Pituitary fossa or the sella turcica. Sella turcica. Now let me join this. The lesser wing of sphenoid and the petrous part of the temporal bone divides the skull. You can see what have I drawn this. A very easy way to draw this. This is the interior of the skull. Okay, let me just. Okay, fine. No, just one moment. So that's the interior of the skull or the interior of the cranium. This would be fine now. That's okay. There's a big foramen here. There's something slope here. Okay, I'll start. So this is the lesser wing of sphenoid. That's the petrous part of temporal bone. Now this divides the skull into three fossae. What is this in front? Anterior cranial fossa. What is this in between? The middle cranial fossa. And what is this behind? The posterior cranial fossa. Posterior cranial fossa, right? Now, in this anterior cranial fossa, we get something here. Can anyone tell me what is this plate? This is a perforated plate. It's a perforated plate, and this is what we call as the cribriform plate of ethmoid bone. Cribriform plate of ethmoid. And what comes in from here? What comes in through the cribriform plate of ethmoid? You know, the nose. The upper part of the nose. From the upper part of the nose, there are the olfactory nerves which begin. The olfactory bulb, the olfactory tract, the olfactory stria. So the olfactory nerves would be coming from the upper part of the nose, and they would enter the skull through the cribriform plate of ethmoid bone. The olfactory nerves then join to form the olfactory bulb, the tract, the stria. Okay, so this is the cribriform plate of ethmoid bone. What comes in from there are the olfactory nerves. What is this pointed structure like this? That's the crista galli. Crista galli. Now this is the frontal crest. Frontal crest, and there's a foramen right here. That's the foramen cecum. Foramen cecum. There's a foramen cecum in the tongue also, right? So this is foramen cecum. What is this foramen here? This foramen is the optic canal. Optic canal. And what comes in from here? The optic nerve, which begins from the retina. The optic nerve enters the skull through this canal, the optic canal. So this is what we call as the optic canal. And there's an artery which gets out from here. The artery to supply the eye. Yes, any guesses? Ophthalmic artery. Ophthalmic artery. So that's the optic canal. What lies in this foramen is the optic nerve and the ophthalmic artery. Perfect. Now, that's the lesser wing of sphenoid. Students, that's the lesser wing of sphenoid. And just below the lesser wing of sphenoid, there's a big fissure. A foramen which is stretched. A foramen when stretched becomes a fissure. Now, just below the lesser wing of sphenoid, there's an elongated fissure. We call this as the superior orbital fissure. Superior orbital fissure. And if we look through this superior orbital fissure, like suppose if that's the superior orbital fissure, I'm inside the skull, I'm looking through the superior orbital fissure, and what do I see in front? Any guesses? Any guesses? What do I see in front? No, not the eyeball. Not the eyeball. This is a skull, not a living person. So yes, what do we see? The orbit. Orbit, not the eyeball, the orbit. We are looking in a skull, not in a living person. So through the lesser wing of sphenoid, below the lesser wing of sphenoid, that's the superior orbital fissure. And if I look through the superior orbital fissure, what do I find in front? The orbit. And any structure going towards the orbit will pass through this foramen, this fissure, that's the superior orbital fissure. Clear, students? So any structure from the skull, if it has to go to the orbit, it has to pass through the superior orbital fissure. Any guesses? Which structure go to the orbit? Any guesses? Yes, the nerves. Yes, very good. The nerves which are supplying the extraocular muscles, right? The nerves which supply the extraocular muscles. You know, all the extraocular muscles of are supplied by which nerve? All the extraocular muscles are supplied by oculomotor nerve. That's cranial nerve number 3, oculomotor nerve. Except, yes, there are always exceptions, except lateral rectus, LR6SO4. That's the formula, LR6SO4. Lateral rectus is supplied by the 6th nerve. That's the abducens nerve. And the superior oblique is supplied by 4th nerve. That's the trochlear nerve. LR6SO4, lateral rectus by 6th nerve, superior oblique by 4th nerve. So 3rd nerve, 4th nerve and 6th nerve would enter the orbit through the superior orbital fissure. Perfect. So that's about the anterior cranial fossa. Now coming to this middle cranial fossa. So let me just write this down for you. We'll just write this down. These 3 things we'll write down. Okay. So what was this number? I'll put number 1 there. That's the cribriform plate. Cribriform plate of ethmoid. And what passes to this? Olfactory nerves. Olfactory nerves. That's number 1 cranial nerve, olfactory nerve. Number 2nd is the optic canal. Optic canal. And what passes from there is the optic nerve and ophthalmic artery. This ophthalmic artery is a branch of internal carotid. Not external carotid. It's a branch of internal carotid. And you remember, students, this branch of ophthalmic artery, which was anastomosing at the medial angle of the eye. Yes, anyone? The branch of ophthalmic artery, which was anastomosing at the medial angle of the eye. We have seen this in the lecture of face. The dorsal nasal branch. The dorsal nasal branch of ophthalmic artery is going to anastomose with the angular branch of facial artery. So at the medial angle of eye, I've told you there's an anastomosis between the external carotid and internal carotid, right? Which branch of external carotid? Yes, facial. And which branch of internal carotid? Ophthalmic. And which branch of facial? Angular, or it's a continuation of facial. And which branch of ophthalmic? Dorsal nasal branch. Perfect. Very good. You're all very good students. Excellent. Okay, and coming to number 3, superior. Okay, superior orbital fissure. Superior orbital fissure. And what passes from here? The 3rd nerve, the 4th nerve, the 6th nerve. Okay, 3rd, 4th and 6th nerves go into it. The 3rd, 4th and 6th nerves are going to supply the extraocular muscles, right? All the extraocular muscles are supplied by 3rd nerve except the lateral rectus, which is supplied by 6th nerve, and the superior oblique, which is supplied by the 4th nerve. And students, there's a sensory nerve supplying the eye. The sensory nerve supply of the eye. Who's that? Any guesses? We have got 3 divisions of trigeminal nerve: ophthalmic, maxillary, mandibular. So who's this? Ophthalmic nerve and ophthalmic division of trigeminal nerve. So clear? So through the superior orbital fissure passes the 3rd, 4th, 6th and the ophthalmic division of trigeminal nerve. Let me just label this for you, students. So that's number 1. I'll write it here. That's number 1. That's number 2. And that's number 3. So we've done with the anterior cranial fossa. Clear? That's the lesser wing of sphenoid. That's the petrous part of temporal bone. That's the pituitary fossa. The pituitary gland lies here, the sella turcica. What is this, students? That's the greater wing of sphenoid, right? Greater wing of sphenoid. We're looking from inside the skull. That's the greater wing of sphenoid. If you look from the base of the skull, this greater wing of sphenoid was forming the roof of what? Yes, answer this. This greater wing of sphenoid forms the roof of a region. What do you say? Yes, yes, yes. Come on, come on. Guess, guess. We've done this in the previous lecture. Excellent. The infratemporal fossa. Very good students. The infratemporal fossa, the roof of infratemporal fossa is formed by the greater wing of sphenoid. That is from below. This we are looking from inside the skull. From below, from the base of the skull, that is going to form the roof of infratemporal fossa. Excellent. And now we get foramens here. Look, this is the first foramen. This is what we call as foramen rotundum. This is Foramen Ovale. This is Foramen Spinosum. So I'll just number this as 4, 5, 6. And this is a big foramen here, 7. That's Foramen Lacerum. Foramen Lacerum. Okay. So we'll just see this Foramen Rotundum, Foramen Ovale, Foramen Spinosum, and Foramen Lacerum. Let us just write this down. What passes through this foramen? Okay. So I'll write, we'll start like this. Number 4. Number 4 is Foramen Rotundum. Yes, any structure, anyone? What passes through the foramen rotundum? Any guesses? The maxillary division of trigeminal nerve. The maxillary division. I'll show you the slide. Just wait. So what passes from here is the maxillary nerve, which is a branch of trigeminal nerve. The maxillary nerve leaves the skull through the foramen rotundum. I'll show you the slide. Just have a look at the slide. See if you can understand this. Look at this slide. A beautiful slide. A beautiful slide. Look at this. What is this view, students? That's a section of the skull, correct? What is this? This is the trigeminal ganglion. That's the trigeminal ganglion. The trigeminal ganglion is also known as the Gasserian ganglion. And this trigeminal ganglion is covered by a fold of dura mater. A fold of dura mater is going to cover the trigeminal ganglion. It forms a cave in which this trigeminal ganglion lies, and this cave is known as the Meckel's cave. Meckel's cave. Just to protect this trigeminal ganglion, look, I'll tell you like this. To protect this trigeminal ganglion, there's a covering of dura mater here, a covering of dura mater which forms a cave, and in this cave lies the trigeminal ganglion. The name of this cave is Meckel's cave. So who lies in the Meckel's cave? That's a trigeminal ganglion. Perfect. Now from this trigeminal ganglion, students, we have got 3 branches. What is this? This is V1 ophthalmic, this is V2 maxillary, and this is V3 mandibular. So what is this that you're seeing? This one, that's the superior orbital fissure. That's the superior orbital fissure, and the ophthalmic division enters the superior orbital fissure, and where are we? That's the orbit, right? That's the orbit. So the ophthalmic division passes through the superior orbital fissure and enters the orbit. Am I clear? Now in this orbit, students, just appreciate this. You can see a ganglion. Look how beautiful. Now what is this ganglion? That's the ciliary ganglion. So this ciliary ganglion lies in the orbit. Now, what are these ganglions? What is the function in the nervous system? That we'll see later. But I just want you to understand, to have a look at this ganglion. So that's the ciliary ganglion. Perfect. So that's the ophthalmic division of trigeminal nerve. Excellent. Understand this. This is beautiful, students. Just try to appreciate this. Now, that's the maxillary division. We call this as V2 maxillary division. What is this foramen here? That's the foramen rotundum. The maxillary nerve leaves the skull through the foramen rotundum. Students, can you identify this? That's the lateral pterygoid plate. That's the lateral pterygoid plate. That's the maxilla bone. What is this? What is this fissure? Or what is this fossa? We have seen this. We have seen this in the morning. I mean, we have seen this in the previous lecture, sorry. So what is this fossa? I told you we were sitting in the infratemporal fossa. In the previous lectures, if you have seen, we were sitting in the infratemporal fossa. I look lateral. What do I find? The ramus of the mandible. I look medial. What do I find? The I find the pterygopalatine fossa, right? That's the pterygopalatine fossa. And have I not told you there's someone who lies in this pterygopalatine fossa? Who's that? The pterygopalatine ganglion. Pterygopalatine ganglion. And look how beautiful, students. Appreciate this. This pterygopalatine ganglion is hanging. It is hanging in this pterygopalatine fossa. It is hanging from a nerve, and that nerve is the maxillary nerve. Can you appreciate this? The maxillary nerve enters the pterygopalatine fossa, and who's hanging from the maxillary nerve? The pterygopalatine ganglion. Look, I'm making the ganglions for you. Ciliary, you know. Pterygopalatine, you know. Right? Right, once again, so this maxillary division of trigeminal nerve leaves the skull through the foramen rotundum, enters the pterygopalatine fossa. The ganglion is hanging from the maxillary nerve in this fossa. Now it goes straight, 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 straight. And look, students, what's this? Orbit. What's this below the orbit? The infraorbital foramen. The nerve gets out from the infraorbital foramen. The nerve is now known as infraorbital nerve. Look at this. Beautiful. That's the infraorbital nerve. So infraorbital nerve is a continuation of maxillary nerve. We have seen infraorbital nerve, sensory nerve supply of the face, you remember? The branches of maxillary division, infraorbital, zygomaticofacial, zygomaticotemporal. Remembering this? So that's the same infraorbital nerve. So this is a maxillary nerve. Once again, very important. The maxillary nerve leaves the skull through the foramen rotundum, enters the pterygopalatine fossa, and goes straight out as the infraorbital nerve. In the pterygopalatine fossa, who's hanging from the maxillary nerve? The pterygopalatine ganglion. Pterygopalatine ganglion. Perfect. Okay. So ophthalmic, maxillary, and who's this? Our mandibular nerve. That's the mandibular nerve. The mandibular nerve will leave the skull through the foramen ovale. Okay, the mandibular nerve leaves the skull through the foramen ovale. And where is the mandibular nerve now? Can anyone tell me? Yes, students, where is the mandibular nerve? The moment the mandibular nerve gets out through the foramen ovale, oh, wow, where am I? Where am I? Where's the mandibular nerve now? I've told you this in the previous lecture, students. The mandibular nerve is now in the infratemporal fossa. I'm so sorry for that. The mandibular nerve is now lying in the infratemporal fossa, correct? So the moment it gets out from here, that's the infratemporal fossa. And you can see this nerve which arises as two roots from the mandibular nerve. Any guesses? Any guesses? We have seen the mandibular nerve in the previous lectures. This is a nerve which arises as two roots. Auriculotemporal. Excellent. Auriculotemporal nerve. Perfect. Perfect, perfect, students. You're all very good. You're all very good. So let us have a look at this foramen rotundum. So what passes through the foramen rotundum? Maxillary nerve. Coming to the next foramen. Yes, the next foramen, number 5, is foramen ovale. Foramen ovale. And what passes through the foramen ovale? What passes through the foramen ovale? There's a mnemonic to remember this. M-A-L-E. What is M? Mandibular nerve. Mandibular nerve. A, accessory meningeal artery. Yes, accessory meningeal artery. Can anyone tell me this accessory meningeal artery is a branch of? Students, you're very nice. You're very good. Excellent, students. Yes, very nice. This accessory meningeal artery is a branch of the first part of maxillary artery. First part of maxillary artery. Accessory meningeal, middle meningeal. You remember? Branches of maxillary artery. Very important. Excellent. L. L is the lesser petrosal nerve. Lesser petrosal nerve. And E is emissary vein. E is the emissary vein. So M, mandibular nerve. A, accessory meningeal artery. L is the lesser petrosal nerve. E is the emissary vein. Right? Now coming to the next foramen, foramen spinosum. Students, you remember this foramen spinosum? We have discussed this in the infratemporal fossa. We have discussed this in the mandibular nerve. Remember, the mandibular nerve gets out through the foramen ovale, lies in the infratemporal fossa. The mandibular nerve had to supply the meninges of the middle cranial fossa. I told you it forgets to supply the meninges when it is inside the skull. So when it gets out of the skull, it suddenly realizes, my God, I had to supply the meninges. Now what do? So the mandibular nerve sends a branch, and this branch goes in the reverse direction of the parent nerve. This is what we call as the meningeal branch, because it supplies the meninges, goes in the reverse direction, therefore recurrent branch. And it passes through the foramen spinosum, therefore known as nervus spinosus. You know this. Enters through the foramen spinosum and supplies the meninges of middle cranial fossa. Excellent. So foramen spinosum, what passes is, let me just write this down for you. Foramen spinosum, yes, a recurrent branch of mandibular nerve, or it is also known as the meningeal branch of mandibular nerve, or it is also known as nervus spinosus, nervous spinosus. And what else passes? And middle meningeal artery. Middle meningeal artery. Okay, so these three are the same one. The different name for the same nerve, recurrent branch of mandibular nerve or meningeal branch or nervous spinosus. Same. And what else passes is the middle meningeal artery. And this middle meningeal artery is also a branch of the first part of maxillary artery. You know this, right? And this middle meningeal artery lies between the skull and the dura mater, right? It lies between the endosteum of the skull and the dura mater. It lies outside the dura mater. And when there's an injury, there's a rupture of one of the branches of a middle meningeal artery. So this bleeding is going to be between the skull and the dura mater. We call this hemorrhage as, yes, extradural hemorrhage. Extradural hemorrhage. Because the middle meningeal artery lies between the meninges and the dura mater. So the hemorrhage is going to be the extradural hemorrhage. Remember that. Fine, perfect. Clear with this? And the last one, number 7, is foramen lacerum. Foramen lacerum, what passes through the foramen lacerum? Actually, they say foramen lacerum is closed in life. I'll tell you this later, but what passes through the foramen lacerum is the internal carotid artery and the deep petrosal nerve. Deep petrosal nerve. Now, what is this deep petrosal nerve? I'll tell you somewhere in later. It's the sympathetic plexus around the internal carotid artery. The nerve which we get is the deep petrosal nerve. So what passes through the foramen lacerum is the internal carotid artery and the deep petrosal nerve. What is deep petrosal nerve? It's the sympathetics around the internal carotid artery. Perfect, test students, clear? So what are we discussing? Look, we are discussing the middle cranial fossa. Middle cranial fossa, that's the area for pituitary gland. That's the foramen rotundum. Number 4, what passes through it? Maxillary nerve. That's number 5, foramen ovale. What passes through it? MALE. Number 6 is foramen spinosum. I've told you that. And number 7 is foramen lacerum. Lacerum. Okay, students. Clear to all of you? Perfect. Now coming to the last part, the part behind, that's the posterior cranial fossa. Posterior cranial fossa, understand this now. What is this bone? This bone is very hard like a rock. It's very hard like a rock. We call this bone as the petrous part of the temporal bone. Petrous part. What is this part of the temporal bone? Squamous part. Okay, what is this part of the temporal bone? Petrous part. What is this part behind the ear? Mastoid part. Mastoid part of the temporal bone, right? So squamous part, petrous part, mastoid part of the temporal bone. Now, in this petrous part, which is very hard like a rock, what lies within it? The ear, the internal ear and the middle ear. The internal and the middle ear lies within the petrous part of the temporal bone. Now, suppose, students, if I have to enter the ear from outside, there's a foramen right here. What's this foramen? External acoustic meatus. External acoustic meatus. From here, I go into the external ear, right? But suppose if I have to enter the ear from inside the skull. Now, we are inside the skull and I have to enter the ear from inside the skull. Should I not have a foramen there? Yes. So, we have been provided by a foramen here. And this foramen, if we enter into this foramen, we go into the internal ear. Now, this foramen, what was this? External acoustic meatus. So, what is this going to be? The internal acoustic meatus. Internal acoustic meatus. That's number 8. I'll write it here. 8. Internal acoustic meatus. What would pass through this foramen? What would pass? The vestibulocochlear nerve, yes, to supply the vestibule and the cochlea, vestibulocochlear nerve. The facial nerve enters into this internal acoustic meatus. The course we'll discuss later. So the facial nerve enters into this internal acoustic meatus. The vestibulocochlear nerve enters this, and there's an artery to supply the labyrinth. Labyrinth. What do you call this as? A labyrinthine artery. Very good. The labyrinthine artery would enter the skull through this, would enter the ear through this foramen named internal acoustic meatus. Perfect. Now we have a big foramen here. Oh, big foramen. What's that? Jugular foramen. This number 9, I'll write this as the jugular foramen, right? That's the jugular foramen. That's the internal acoustic meatus. What is this big foramen? Number 10, that's the foramen magnum. And there's a foramen on either sides. I'll write this as number 11. There's a foramen on either sides of the foramen magnum. This is what we call as the hypoglossal canal. Hypoglossal canal. So hypoglossal canal is on either sides of the foramen magnum. Okay, let me just write this down for you. Number 8, number 8 is the internal acoustic meatus. Okay, number 8 is the internal acoustic meatus. Internal acoustic meatus. And what passes through it? The 7th nerve, the 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and the labyrinthine artery passes through this internal acoustic meatus. Number 9 is a big foramen, jugular foramen. Jugular foramen, and this jugular foramen has got 3 compartments. It has got 3 compartments. One is the anterior compartment, one is the middle compartment, and one is the posterior compartment. I'll just write this for you. I'll explain this after some time. So what passes through the middle compartment of the jugular foramen? The 9th, the 10th, and the 11th nerve. The 9th, the 10th, and the 11th nerve passes through the jugular foramen. The 9th, 10th, and 11th nerve passes through the jugular foramen. Through the posterior compartment, what passes is sigmoid sinus. Now, what is sigmoid sinus? I'll tell you. We'll discuss this after some time. Sigmoid sinus. And anterior compartment, what passes is inferior petrosal sinus. Inferior petrosal sinus. So, anterior compartment, what passes is inferior petrosal sinus. Middle compartment, 9th and 11th cranial nerves, and the posterior compartment, what passes is sigmoid sinus. Sigmoid sinus. Okay, clear to all of you? Now, number 10. We'll discuss this sinuses after some time. Number 10 is foramen magnum. This foramen magnum is divided into 2 compartments. Foramen magnum is divided into 2 compartments by alar ligament of dens. Alar ligament of dens. You know the second cervical vertebrae. The first is atlas. The second cervical vertebrae is axis. The axis has got a process like that. What's that? Odontoid process. From the odontoid process, from the tip, there's a ligament which goes up inside the skull. That's the apical ligament of dens. From the apex of the dens, a ligament goes inside the skull. That's the apical ligament of dens. From the apex of the dens, there's a ligament which goes sideways like this, and it divides the foramen magnum into 2 compartments, anterior and posterior compartment. That ligament is known as the alar ligament of dens. Alar ligament of dens. So attached to the dens are 2 ligaments. One is the apical ligament of dens, which is a remnant of notochord. One more thing I'm telling you. So apical ligament of dens is a remnant of notochord, and second is the alar ligament, which goes like this horizontally, divides the foramen magnum into 2 compartments, students. So this we get 2 compartments. One is the anterior compartment and the other one is the posterior compartment. Anterior compartment, posterior compartment, right? What passes through the anterior compartment are the bones and the ligaments. Bones and ligaments. So we call this as the osseo. Osseous is bones. Ligamentous. Osseo-ligamentous compartment. So bones and ligaments pass from here. So this is osseo-ligamentous compartment. What passes from the posterior compartment are nerves and vessels. Nerves and vessels. So the posterior compartment is also known as the neurovascular compartment. Neurovascular compartment. So bones and ligaments from the anterior compartment, therefore osseo-ligamentous. Nerves and vessels from the posterior compartment, therefore neurovascular compartment. Clear? Now what are the bones and ligaments which pass through the anterior compartment? Let me just tell you. Bones and ligaments which pass through the anterior compartment. One is the tip of the dens. What is dense? Second cervical vertebrae ka part is the dense. It's the second cervical vertebra that is also known as the dense, and the odontoid process of the dense passes to it. Second, apical ligament of dense. Apical ligament of dense. Apical ligament, I told you it's a remnant of notochord. And third, cruciate ligament. Cruciate ligament. Students, this dens is very important. Okay, and this dens has to be kept in position, because if this dens moves, who's lying behind the dens in the posterior compartment? What lies is the medulla. The medulla oblongata lies in the posterior compartment. So if the dens dislocates and hits the medulla, the person gets an instantaneous death. Where do you see this? The dens gets dislocated, goes and hits the medulla, the person dies. That is seen in hanging. Right? So anterior compartment of foramen magnum, the dens is present. Dens, the second cervical vertebrae, the dens is present. And in the posterior compartment, the medulla oblongata lies. So the dens has to be properly kept in position. So there's an egg-shaped ligament which keeps the dens in its place. That's the apical ligament of dens. That's the cruciate ligament. I'm so sorry. That's the cruciate ligament. And during hanging, when a person hangs, this dens is dislocated, hits the medulla, and the medulla contains many important centers of respiration and circulation. So if the medulla is injured, the person dies instantaneously. That's in hanging. Clear, students? Right, very good. What passes through the posterior compartment or the neurovascular compartment is the lower part of medulla. It's not the spinal cord, lower part of medulla and the meninges. Lower part of medulla and meninges. What else? The spinal accessory nerve. We'll discuss this later. What is this? Spinal accessory nerve. What else passes from here? Vertebral artery. Vertebral artery. Vertebral artery which is entering the skull passes to this foramen. Vertebral artery. The branches of vertebral artery go down. Which are the branches of vertebral artery? Anterior and posterior spinal arteries. Anterior and posterior spinal arteries. These are the branches of vertebral which are going down. The last thing is a part of cerebellum that is known as the tonsils. Tonsils, sorry. This is tonsils of cerebellum. Tonsils of cerebellum. It's a part of cerebellum which is projecting down. That's the tonsils of cerebellum. So be very clear about this, students. I've told you in details the foramen magnum and the structures passing through the foramen magnum. Perfect. Is this clear? And just one last foramen left for us. What was that number? 11. Number 11 is the hypoglossal canal. Hypoglossal canal. It is also known as anterior condylar canal. Hypoglossal canal or the anterior condylar canal, and what passes through it is the hypoglossal nerve. Hypoglossal nerve passes through it through the anterior condylar canal or the hypoglossal canal. What passes is the hypoglossal nerve. Perfect, students. So we have discussed this in details. The interior of the skull, have a look at this. So that's the lesser wing of sphenoid. Let me quickly go through this. That's the lesser wing of sphenoid, right? And that's the petrous part of temporal bone. So this is the anterior cranial fossa. That's the middle cranial fossa. And that's the posterior cranial fossa. In the anterior cranial fossa, what do we find here? That's the cribriform plate of ethmoid. What comes in from here are the olfactory nerves. That's the frontal crest. And here is the foramen cecum. Not behind. In front is the foramen cecum. That's the optic canal here. This is the superior orbital fissure. Third, fourth, sixth, and ophthalmic nerves passes. That's the foramen rotundum. That's the foramen ovale. That's the foramen spinosum. And this is the foramen lacerum. Foramen lacerum. That's the sella turcica or the area for pituitary gland. That's the petrous part of temporal bone, right? And you'll find a foramen here, not very clearly seen, but that's the foramen What is the name of this foramen? Internal acoustic meatus. You get a big foramen here. That's the jugular foramen. That's the foramen magnum. And on either sides, there's a foramen here. That's the hypoglossal canal. That's the occipital crest here. Occipital crest. Who lies here are the cerebellum. This is the occipital bone. What lies here are the cerebellum. Now you get something else also. You can see this. This is the groove for a sinus here. I'll draw that for you. That's the groove for sinus. Okay, perfect. So this was the slide here. So there is a sinus here, students. Let me just tell you this. Behind there's a groove for a sinus here, and this sinus is a transverse. So here we get the groove for transverse sinus. Groove for transverse sinus. Okay. Now this transverse sinus then becomes an S, students. The transverse sinus then becomes an S like this. S is known as sigmoid. So this is now known as sigmoid sinus, and this sigmoid sinus leaves the skull through the posterior compartment of jugular foramen. Clear? So what is this now? This is going to be the sigmoid sinus. You can see the writing, no? That's a sigmoid sinus. Very good. So the transverse sinus becomes an S. That's the sigmoid sinus. And what passes to the posterior compartment of the jugular foramen is this sigmoid sinus. Now the sinuses will study it separately. That's the petrous part of temporal bone. On the petrous part, there are two sinuses here. One is on the superior border. One is on the inferior border, which gets out from here. So what is this sinus? That's the superior petrosal sinus. Superior petrosal sinus. And what is this sinus? That's the inferior petrosal sinus. Inferior petrosal sinus. Along the superior border of petrous part, superior petrosal. Along the inferior border is the inferior petrosal. This inferior petrosal sinus leaves the skull through the anterior compartment of the jugular foramen. Anterior compartment of jugular foramen. Clear, students? I hope this lecture is clear to you. So now just understand. All the cranial nerves will get outside the skull through various foramens that we have. So the cranial nerves would get outside the skull through various foramens, except there are only two nerves which are coming inside the skull. Which are these two nerves which are coming inside the skull? Number one, cranial nerve. That's the olfactory nerve. Enters the skull through the cribriform plate of ethmoid. The optic nerve enters the skull through the optic canal. Rest all the nerves will be getting out of the skull. Tell me, students, now. Third, fourth, sixth nerve. How do they get out? 3, 4, 6 gets out through the superior orbital fissure, enters the orbit. The fifth nerve divides into 3 divisions: ophthalmic, maxillary, mandibular. Ophthalmic division gets out through foramen, through the superior orbital fissure. Maxillary division, foramen rotundum. Mandibular division, foramen ovale. 7th and 8th nerve enters the internal acoustic meatus. 9th, 10th, 11th enters the middle compartment of jugular foramen. And the 12th nerve passes through the hypoglossal canal. I hope, students, this interior of skull is very clear to you with the various foramens that I have told you. Okay, I hope this should be clear to all of you. If there are any doubts, do get back to me. But before going, see, look at this sinus. This is what I was telling you. So this, what is this sinus? Look at this. What is this sinus? That's the transverse sinus. Transverse sinus. And this transverse sinus becomes an S. What is that? Sigmoid sinus, which leaves the skull through the posterior compartment of jugular foramen. This is going to be the superior petrosal, and there's going to be an inferior petrosal that we'll see later. Okay, answer this. MCQ. This is the MCQ that you will be getting. A 28 years old male comes to physician because of persistent tingling sensations on the right side of face. The sensation begins after he underwent an extraction of impacted molar tooth. Examination shows decreased sensations of the skin on the right side of the mandible and anterior portion of the tongue. Taste sensation is preserved. The affected nerve exits through which of the following openings? Decreased sensation of the skin on the right side of the mandible and the chin and the anterior portion of the tongue. So what do you say? Which is this nerve? This is the mandibular nerve, right? So anterior portion of the tongue is supplied by lingual nerve, which is a branch of mandibular nerve. which is a branch of mandibular nerve, and decreased sensations of the skin over the mandible, right? So this is basically the trigeminal nerve which passes to foramen ovale, foramen ovale. Stylomastoid foramen, what passes is the facial nerve. We'll see that later. That's the facial nerve. Clear? So which of the following nerves are present in the posterior cranial fossa? Now this is a very tricky MCQ, students. Remember, all the nerves would begin from where? All the nerves begin from brainstem. One moment. All the nerves begins from the brainstem, the midbrain pons medulla. This is where all the nerves would begin from. And you can see the slope here. You can see the slope. This slope is what we call as clivus. And who lies on this clivus? The brainstem. The brainstem is lying on the clivus. Brainstem meaning midbrain pons medulla. All the cranial nerves would begin from the brainstem, if I tell you. That means all the cranial nerves meaning first and second, no, the first and the second is entering inside the skull. 3 to 12 cranial nerves, number 3 to number 12, they begin from the brainstem. The brainstem is lying here on the clivus. This clivus is present in which cranial fossa? Posterior cranial fossa. That means the brainstem is present in the posterior cranial fossa. That means all the cranial nerves, 3 to 12, to begin with, would be present in the posterior cranial fossa, right? So nerves present in the posterior cranial fossa, your answer is going to be 3 to 12. 3 to 12. Clear to all of you? Nerves present in the posterior cranial fossa, that's 3 to 12. I hope this is clear to all of you. All the following pass through the foramen ovale except, just remember that mnemonic M-A-L-E, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and E is emissary vein. What are emissary veins? The veins which connects the veins outside the skull with the veins inside the skull. They are known as emissary veins. So the answer for this is middle meningeal artery. It passes through foramen spinosum. Middle meningeal artery passes through foramen spinosum. Perfect. Mass in the jugular foramen may result in all except. So mass in the jugular foramen would compress on these 3 nerves which pass through the jugular foramen, 9th, 10th and 11th cranial nerves, 9th, 10th and 11th. So what is the 9th nerve supply? Okay, hoarseness of voice is the involvement of 10th nerve. Involvement of 10th nerve would lead to hoarseness of voice. Difficulty in swallowing, difficulty in turning the neck to the opposite side, that's the 11th nerve. Difficulty in turning the neck to the opposite side. Okay, who turns the neck to the opposite side, students? Which is the muscle which is going to turn the neck to the opposite side? That's a sternocleidomastoid. And which is the nerve which supplies the sternocleidomastoid? The accessory nerve which passes through the jugular foramen. Tongue is supplied by which nerve? 12th nerve. Tongue is supplied by 12th nerve, and the 12th nerve is passing through which canal? Hypoglossal canal. Difficulty in swallowing. The swallowing is done by which nerve? 9th nerve. 9th nerve helps in swallowing. The gag reflex and all is 9th nerve. So if there's a mass in the jugular foramen, which nerves is it going to compress? 9th, 10th and 11th. 9th nerve compression would lead to difficulty in swallowing. 10th nerve would lead to hoarseness of voice. 11th nerve compression would lead to difficulty in turning the neck to the opposite side. So what is not seen is the tongue deviates to the same side. That's a lesion of hypoglossal nerve. Hypoglossal nerve injury, hypoglossal nerve supplies the tongue. And okay, clear to all of you? Is this clear, students? Tell me. Clear. So this interior of skull is a very, very important lectures. The various foramens, get oriented to the various foramens. Anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Clear to all of you? The various foramens which are located in the cranial fossa. And there's a groove behind on the occipital bone for the transverse sinus, which then becomes an S-shaped sigmoid sinus, which leaves the skull through the posterior compartment of the jugular foramen. Anterior compartment of jugular foramen is the inferior petrosal sinus. This we'll see in the dural venous sinuses. Clear, students? I hope this lecture is clear to all of you and all your doubts, your queries are solved. I've shown you some very important MCQs, typical of what is asked in the exams of yours. Thank you so much for your patient listening. Thank you, students. In case of doubts, do get back to me. Happy learning till then. Thank you.